I'm going to turn it over to Jim Pinkerton, who served in the Reagan administration and the Bush administration. He's also a political analyst with the Fox News channel, and he's a regular on Fox News. So what do you think happened last night, and what does it mean for America?
Another category, though, was things that that didn't get talked about, and I think that's very unfortunate. And first on that list, I would talk about healthcare defined as medicine, defined as curing things. We've had, since the Clinton era, we've had abundant discussions of healthcare finance, healthcare insurance, who should get insured, who shouldn't get insured, so on and so on. And during the same 20-year period, the quantity of medicine actually emerging from the medical scientific pipeline has plummeted. The number of new drugs approved by the FDA is down 63% in the last 15 years. The number of new medical devices is down 40%. The number of new antibiotics is down 80%. The amount of venture capital in the field is down anywhere between 1/3 and 3/4, depending on which source you look to, but nobody thinks it's going up. In other words, we're in this paradoxical situation, and again, President Obama's reelection will only enunciate this further. We are committed to taking care of everybody in this country on their health care. The truth of the matter is we've had a sort of crude version of national health insurance since EMTLA, the Emergency Treatment and Labor Act of 1986, was signed by President Reagan, which says that you can go to an emergency room and get treated. That is not a particularly satisfactory way to do health care, but it is a way, and nobody really disputes that would ever stop happening in the future, no matter who had won the election last night. But again, we now have an enhanced and sort of, if you will, mandated, in sense of an election mandate, commitment to if you're an American, a citizen or not, you're going to get covered, you're going to get treated, you're going to get everything. And so the challenge then is, how do you make it cheaper? 6 million Americans in this country today have Alzheimer's, and that's a $172 billion hit on the economy, according to the Alzheimer's Association. And again, Jennifer, who's done great work on this, has some pieces of paper, I suppose, are outside or on your chairs, which I would call your attention to on this. It is very hard to see how anybody, whether it's the Obama administration working or not working with Paul Ryan, who will be returning to the Congress, or the Gang of Six, or Simpson Bowles, anybody who is wrestling around with these issues, how you're going to make progress long term on Medicare costs with Alzheimer's, which again, now 6 million people, $172 billion, 30 years from now, 25 million people, and an annual cost of $1 trillion, or trillions plural, and for a cumulative cost between now and 2050 of 20 trillion with a T. That's a lot of money, and all the market forces and all the empowerment and all the everythings and better management aren't going to change the fact that if people are in a state of dementia for 20 years in a nursing home, it's a very labor-intensive and very costly process. And I think it's very unfortunate that these issues did not get raised during the campaign. My friend Lou Weisbach, who's in the audience here, has started up a group called the American Center for Cures, which has been pushing the idea that a cure is cheaper than care. It's cheaper to beat a disease than to treat a disease. And so he and I met with Dr. Francis Collins at the NIH this morning, and the meeting ran long because it's such a robust topic, and that's why I'm late, and I apologize again for that. I do think that, and maybe this is just wishful thinking on my part, but it just the urgency of the situation to make budget cuts that don't lead to the political destruction of the people making them. And I speak for both parties now. I mean, again, the one lesson of 2010 is when the Republicans came out against the Affordable Care Act. They had the Medicare cuts in there, the Obama administration's Medicare cuts to the Medicare Advantage program, and they made hay out of that. big time. And in 2012, again, all the exit polls have to get crunched and everything, but it certainly seems as if the revival of that statement, that the so-called $716 billion cut in Medicare that the Affordable Care Act put into place, did seem to take a lot of the sting out of the Democratic attacks on Paul Ryan and the Ryan budget and so on. So they kind of played each other to a draw. But it's sort of a strange situation now. We go into 14 where we've sort of had lessons in the voters just don't like Medicare cuts. Now, if the Medicare cuts and changes and vouchers and premium support, whatever you want to call it, are inevitable for fiscal reasons, so be it. But then that puts an enormous incentive to people like Dr. Collins and Lou Weisbach, who can think, and Jennifer, who can think of ways to help mobilize the country on behalf of actually solving some of these medical problems. We don't spend money on polio now because we cured polio. The Milken Institute 2 or 3 years ago found an old study that the government had done in 1950, in which it had projected that if present trends on polio treatment, which is to say wheelchairs and iron lungs, continued through the year 2000, the cost would have been about $100 billion a year, which is greater than the federal budget. Now, of course, adjusted for inflation, that $100 billion is more like $1 trillion, excuse me, and so that would have been pretty daunting for anybody's budget balancing plan. And instead, happily, in 1955, Dr. Jonas Salk, working in sort of what was effectively a public-private partnership, cured polio. The disease went away, and we don't spend anything on polio anymore, at least not in this country. So that's actually, come to think of it, as an interesting 60th anniversary that President Obama is going to confront in his term, 2015, the 60th anniversary of the polio vaccine. And there's also one other anniversary, just while I think of it, that will also be coming up during President Obama's second term, which is in November of 1944, as World War II was coming to a close. President Roosevelt wrote a letter to a fellow named Van Bush, who was the head of the R&D for the Pentagon, and said, listen, we've had this wonderful, heroic, world-saving effort to mobilize technology and radar, proximity fuse, and all number of inventions, synthetic rubber, and of course the atomic bomb. And we need now to bring that same miracle of progress and sort of organized, concerted effort to the civilian front, including medical care. And that document, again, it became the sort of the founding agenda document for the whole post-war effort of completely bipartisan, Truman, Eisenhower, and including the Kennedy-Johnson space mission, to put the curve bending from science on front and center into national policy. And I think it's been unfortunate that scientific emphasis has fallen off of the national agenda over the last few years. And I think we've all paid a price for it, not only in terms of our own health, but also in terms of the future cost of medical programs and healthcare programs. And now I'm optimistic that we can find a way to get it back on the agenda in this second term. I would point, for example, to President Obama's science advisor, the PCAST, Council of Advisors on Science and Technology. If you look on a document that doesn't seem to have gotten any attention, but it did get published from the Executive Office of the President on September 25th, there's a call there for a doubling of the new medical drugs and treatments. Doubling. I think that's a much more refreshing and, frankly, politically popular approach to take as we think about healthcare issues as opposed to budget cuts. And I hope that, frankly, both parties take it up in the next 4 years.